presentation. I am Charity Serena Balmer, junior psychology major at North Carolina Central, studying to become a clinical psychologist to help provide assistance to minority adults. Consequences of racism. Police violence against African Americans. In 2016, according to Huffington Post, police killed at least 258 African American people, with 34% of the 39 unarmed being African American males. Therefore, just seeing the images of this, it reminds of the vulnerability of being harmed simply because of your race and your ethnic background. And therefore, it heightens the fear and anxiety of African Americans, and therefore it also triggers just seeing the images of the innocent African American lives lost. It triggers post-traumatic stress disorder, better known as PTSD. Criminal justice. Minority men, both African American and Latinos, are more likely to be stopped by police, which leads to the increased number of deaths at the hands of police. Racial minorities are more likely to be arrested, convicted, and given more severe sentences than whites. Health-wise, the average risk of death is 26% higher in the black population than the white population. African Americans and Hispanics receive lower quality health care and treatments than those in whites for diseases such as cancer, cardiovascular disease, HIV and AIDS, diabetes, mental health, and other chronic and infectious diseases, also not limited to sickle cell anemia, which is very big in the African American society, and the clinical services. Mental and psychological well-being amongst Black Americans, the greater the perceived racism, the greater the likelihood of mental distress. And several mental health outcomes were significantly associated, such as anxiety and depression and negative self-esteem, all to high risk of discrimination. Higher levels of resilience, self-worth, psychological adaptation, psychological adjustment, and social and adaptive function were all associated with less discrimination. Lastly, housing. According to the Housing Discrimination Study, subtle forms of housing discrimination still currently exist to this day, although the Fair Housing Act is in place. African Americans, along with Hispanics and Asians, are less likely to be informed or shown a housing unit than whites. Evidence-based and promising practices for reducing racism can start with school-based interventions where they utilize multicultural literature materials, role-playing, and cooperative teaching strategies to enable students to be able to interact positively with one another and develop positive racial attitudes. There is also contact hypothesis, interracial contact, where what is known to promote cooperation, generate reciprocal norms, reduce segregation, and increase life opportunities. Also from this, the studies have shown that white contact with blacks were also associated with practices aimed at achieving racial justice. Subordinate group memberships, where they promote team activities and bonding and replacing or reducing stereotypes and creating potential and reducing also potential conflicts. It also creates and brings about a different mindset where it diminishes cultural differences in between one another and students. Lastly, societal organizations and societal approaches focuses on changing norms, laws, and policies that support racism in the community and in the world. Section 2, Neighborhoods and Communities. Disadvantaged neighborhoods. Urban property is spread across big geographic areas that have low population density, leading to more abandoned housing and bigger chances for drug trafficking, drug use, and crime. Women who live in such neighborhoods and who experience a high number of negative life experiences are more likely to become depressed. Neighborhood and child developmental outcomes. Successful neighborhood peers and ethically diverse neighborhoods are associated with higher academic achievement among Black males, and they were more likely to occur in neighborhoods characterized by high levels of disadvantage, while opposed to those with low or moderate disadvantage, the academic level was much higher. So they suggested that there was a threshold between neighborhoods with high levels of disadvantage and ones of low level disadvantage. researching on factors reflecting a positive community orientation among African Americans. Sense of communalism or connection to an individual's community may correlate with spirituality and identity factors among African Americans, which in most is very important. The sense of well-being and life satisfaction among African Americans is usually and can be associated with positive perspectives or experiences of group solidarity and economic achievement. Life satisfaction among African Americans increases as state levels average income for blacks increases. Empirically supported practices for neighborhood improvement would be community empowerment and organization, which helps to build on community assets. The political and social action resource, which is basically the focus on changing social policy through protests and political effort and media and social media, as well as capacity development, which is the creation and individuals working to build local community resource access and capacity to help assist with the people of the neighborhood getting and obtaining what is needed. Cultural empowerment, which emphasizes cultural education and raising cultural consciousness and awareness and empowering and encouraging that they are somebody regardless of where they are. Neighborhood intervention, which is basically focuses on work with individuals as well as group within the community and on the community level, and increases individual level coping, reduce neighborhood risk, and increase community capacity. As we look at section 3, gender differences in friendships, males bond by participating in common activities while girls bond by sharing feelings and emotions. And where findings suggest that females tend to focus on intimate relations with a few other females, while male friendship networks are larger and more spread out. Racial and ethnic differences in friendship networks says that African Americans tend to rely more on biological and fictive kin and include them in their networks more than whites. According to study findings suggest that kin are a large part of the network of African Americans and Caribbean blacks and support the significance of family and kin in African American lives. African American adolescent friendships, racial and minority groups reported fewer friendships and socialized less than whites. African American adolescents are known, according to studies, to choose more friends who are more from different schools than the one and the same, and they also are less likely to choose somebody that is more similar, that's not similarly academically. So they would choose somebody either more higher than them or more lower than them. And with regards to drug use, and who are similar in ethnic identity. It also says that African American adolescent males who excel academically are less likely to be accepted by their African American peers. African American adolescent male friendships. Although there is limited research, adolescent minority males like to play, conquer, and boast rather than talking together and sharing personal perspectives on life. And the reasons for that is because they believe that having close bonds with each other as males is feministic. African American adolescent female friendships are positive and fulfilling relationships that are critical, especially to African American girls' identity and their self-worth. For at this time, girls are more likely to engage in relational aggression than boys, while boys themselves are involved in physical aggression. The best practices for improving relationships. Culturally enhanced programs for girls, which is designed to increase cultural attributes such as ethnic identity and pride, while increasing positive and mutually fulfilling relationships among young adolescent girls. This program was known as Sisters of Naya. On the other hand, there's a culturally enhanced program that utilizes culturally a curriculum for pre-adolescent and adolescent boys, where they use culturally grounded methods to bring African American boys together to promote appropriate interpersonal skills and pro-social behaviors. Studies have found with health promotion, disease prevention, and healthcare utilization that living in neighborhoods with no safe spaces or places to exercise and have high levels of neighborhood crime are some reasons for African Americans to engage in less physical activity, as well as fewer outlets are available within segregated African American neighborhoods that offer healthier food options for purchase. That most African American children that live in neighborhoods are within reach of more fast food restaurants, and they see more more fast food advertisement. Along with more visits, as it's about to say, with the healthcare utilization patterns, African Americans are less likely to have contact with a primary care physician and therefore have results with more visits to the emergency room and longer periods of hospitalization than whites. Also, it is after controlling for socioeconomic status and age that discrimination was associated with more smoking and greater percentage of dietary fat and fewer hours of sleep. And lastly, 23% of African Americans complained of difficulty understanding and comprehending communication from healthcare providers due to providers purposely using professional and or medical or technical jargon to explain their medical condition. Empirically supported practices for reducing morbidity and mortality. System level changes. Number one, universal health care for all Americans, offering insurance for everybody regardless of what racial and ethnic background and or sexuality. Number two, proportionate representation, having more physicians and physician aides, and medical professionals from different cultural backgrounds. And number three, community health programs, offering medical procedures and treatments in the community through programs for those who are not able to obtain the adequate insurance that could give them the same treatment at a bigger facility. Preventing HIV prevention efforts instituted by psychologists have usually targeted behavior change at the individual level, but risk reduction efforts at the individual level are limited. As well as reducing diabetes, behavior change techniques have also been proven to decrease diabetes risk, which we need to push more for in the African American culture. My applications to relevant contents will begin with African American teaching sessions for school age interventions, which will basically have people come in from all different walks of life and different careers and teach students about the accomplishments and the story behind African American history, more on a personal level. Then for the contact hypothesis, there's the interracial seminar sessions that I would use in my program where I would bring people from all races to interact along with other African American students. And they would interact and attend seminars and learn both from both cultures of what has been seen and shown and taught and accomplished in history. Then there is the successor study group, which is part of the subordinate group membership, which would emphasize on making sure that everybody comes together and it reduces stereotypes and reduces different kind of beliefs and different kind of cultural beliefs and disagreements between one another. Lastly, we'll have the multicultural sessions for adults, which is basically the same thing as the African American teaching sessions, but specifically for the adults due to the fact that children learn from their parents. And lastly, we have the racism report line and assistance program, which basically is a line that people will report to when they sense or have experienced any kind of form of a racism, and then the assistance program will step in to bring it to the forefront in the community and the neighborhood. For the applications to relevant contents, for this one, we would use the WeCan program for community empowerment and outreach, which just empowers young kids and parents that anything is possible that we can achieve if we want to. Better affordable housing in neighborhoods would be to push for more assets and more capacity development to increase and improve the neighborhoods and communities. African American community documentaries and community resource programs would do the same thing as the previous one stated, but also put a documentary behind it where it actually shows the dreadful living places of that people really do not get to see firsthand. African American cultural events where we were involved and bring into the light, celebrating, different events that in time and history that have come along, celebrating Harriet Tubman, Muhammad Ali, Martin Luther King Jr., celebrating even up to a musician, celebrating a Etta James, celebrating Aretha Franklin, celebrating a James Brown, celebrating a Michael Jackson, those things, celebrating Obama, celebrating anybody who has bring history to the forefront. Neighborhood Intervention Board, the Neighborhood Intervention Board would be just a board that basically intervenes for the neighborhood. They would make sure that they talk to both individuals and groups, and see what they can do as a whole to improve the neighborhood and surroundings. I would also come up with a buddy mentorship program where boys and girls will both be assigned with another boy and girl and bond. They do different kind of activities along with their head mentor there as a guide. And then after every month, they would rotate the buddy and they would do the same thing every month. And then in between that, they would have events where both the male and females would both come together, go on field trips, come to events along with family and friends, more family and friends, and just interact as a whole. And that right there increases the bond and the friendships amongst the adolescents. Lastly, for the system level changes, I would come up with a community support group for minority social change, as well as a community health support group for African Americans that would address HIV, prevent HIV, and reducing diabetes, as well as nephrosis, which is kidney failure, and other diseases and chronic disorders that come against the African American population, and just to inform and also advise and offer resources. There is my reference list. Questions are as follows. Do you feel like the current social injustice groups like Black Lives Matter are enough for the necessary push for African Americans, or do we need more? What other kind of social injustice group would reduce racism in the African American society? What do you believe, are the characteristics of a poor, disadvantaged neighborhood and the effects that they have on the African American society as a whole? As it has been proven to help with adults, contact hypothesis, would exposing adolescents to kids from different ethnic groups with similar circumstances increase, increase friendships, and why? What health issues that are being faced by the African American society should be addressed mostly, and why? Just remember, anything is possible. Hope you enjoyed. Have a great weekend.